What's going on, everybody? Dr. Vasquez here, coming to you a little bit after 1 o'clock in the afternoon on Sunday. Today is August 10th. This will probably be one of the last videos that I record in this office. In fact, later this afternoon, I'm going to take all the art off of the wall and pack it away. I've already taken all the art off of the other wall. That was actually pretty painful because I just put it up there like 2 months ago, or less than 2 months ago, probably. But we are relocating. So the topic of right now is going to be, and is, talking about vitamin A and the treatment of acute COVID, long COVID, chronic cough after COVID, whatever related to that. So I actually did a video on this. I've done, well, a couple of different videos on this related to this topic. In the first video, I mean, we've always used vitamin A for viral infections and respiratory infections. So that's nothing new. I talked about vitamin A in the protocol reviews that I did back in 2020, 2021, when everybody was freaking out about COVID. At least a lot of people were, except people who actually understand viral infections. We were all like, this is nothing, kinda. So, in the previous videos, I talked about the appropriate dosage. I'm going to talk about that again right now. And we collectively are going to look at some of the review articles that have come out lately in 2025 or earlier. So I started to look at a few of these articles last week, and I saw a very consistent theme in all of them. Actually, I guess I saw 3 different themes. And I'm going to talk about those right now. And I'm going to show you this meta-analysis of 15 trials. I'm going to use this kind of as a discussion piece because it represents the same 3 themes that I just alluded to. The 3 themes are, maybe it's more, but let's start with 3. Vitamin D deficiency increases the risk for COVID complications and chronic cough and all that. So deficiency is associated. Supplementation appears to alleviate acute COVID, long COVID, chronic cough. Oh, and the other thing is they screwed up all these studies by underdosing, and that's mostly what I'm concerned about. So, here's yet another example. So I talked about this previously with vitamin D. I mean, vitamin D against COVID, against acute severe COVID, reduces mortality by 70%, almost 80%. So that data is, in my opinion, untouchable. So when people talk about controversy or something like that, it's because they don't know how to read the damn studies. All of the studies, mostly out of Spain, one out of India, one out of Mexico, at least back then, all of the studies showed safety and like almost miraculous benefits if the dosage was applied appropriately. In contrast, if you look at the American Medical Association that wants to publish garbage and consistently publishes garbage, they published a study where they delayed treatment by more than 2 weeks, and then they gave the wrong form of the treatment, and they gave too much. And as I've said before, the paradox with giving too much vitamin D in what's called a bolus dose is that it spikes blood and tissue levels of cholecalciferol, but without giving enough time, so to speak, to convert that to 25-hydroxyvitamin D, which everybody should know by now. If you've followed my work over the last couple of years, everybody should know by now that that's 80% of the biological activity of vitamin D. It's not 125-dihydroxyvitamin D like everybody learned 15 years ago and prior to that. For the past 15 years, we have known that 25-hydroxyvitamin D is the clinically and biologically active form of vitamin D. If you want to talk about which form is more pharmacologically important or potent, then you would say 125-dihydroxyvitamin D. But because 125-dihydroxyvitamin D levels are very low compared to the higher levels of 25-hydroxyvitamin D, even though 25-hydroxyvitamin D is less potent, it's so much more abundant that it activates that receptor at a higher clinically relevant level. So again, that was just a quick overview. But the vitamin D studies that were done properly were very clear. The bolus studies, which should have never been performed, because the bolus has been outdated now for 15 years. And I even talked about that 21 years ago in my paradigm shift article on vitamin D. I said we shouldn't be using bolus. It doesn't work. We should give it up. But they keep using it because for people who are ignorant about vitamin D pharmacology, including most medical doctors, and the entire medical profession wants to be ignorant on this topic, they say, oh, well, they used high dose vitamin D in the study and it didn't work. Well, of course it didn't work. Not because it was the wrong concept, but because they applied it in a way that was known to be pharmacologically ineffective. So, again, that was my quick overview of vitamin D. You can look at my other articles on that and videos and such. Likewise, with the zinc studies that were also published by the American Medical Association, they manipulated the use of language to make it appear that they had used high dose zinc, and they didn't. They used low dose zinc. So it was really pathetic. I think they did the same thing with the vitamin C study. In a similar way that the New England Journal of Medicine published back in 2006, a really bogus study on chondroitin sulfate and glucosamine sulfate, they strategically and intentionally manipulated the way that they described the treatments and the language that they used so that people would think that they had used glucosamine sulfate, but they used glucosamine hydrochloride, which was already known to be ineffective. So, these details matter a lot, and these details are obviously what separate good clinical interventions from bogus propaganda published by New England Journal of Medicine, Journal of the American College of Cardiology, and obviously Journal of the American Medical Association. So, like I had started to introduce this topic, I started to look at the vitamin A studies last week or so, and again, I saw a consistent theme. People who are vitamin D, did I say vitamin D? I meant to say vitamin A if I didn't, so let me say that again. I started to look at the review of the vitamin A studies a week or so ago, and in those vitamin A studies, again, I noticed a pattern that vitamin A deficiency associated with worse clinical outcomes. The problem with that is a couple different problems with that. Laboratory testing for vitamin A status isn't very accurate. So, we're using the best test available, but even on its best day, it's not that accurate because it doesn't reflect tissue stores and it doesn't reflect the dynamics of vitamin A transport and release that are happening in real time during an acute infection or when people are treated with steroids. I'll talk about that more in just a moment when we look at this review article that I'm using kind of as a discussion piece. So again, the association of vitamin A deficiency with complications is kind of to be expected, even though it's weak based on the laboratory assessment. Vitamin A serum levels could be a surrogate marker for a lot of different things, especially protein intake and therefore zinc intake and therefore financial status and therefore education and a lot of different things. So even though the association is constant, it's still subject to a lot of different variables. The other thing that's been consistently shown is that vitamin A supplementation provides benefit. Okay, that's great. That's pretty much to be expected. It's no big surprise. But again, the third observation that I've had looking at these studies is that they brutally underdosed these studies. And I just think it's stupid. It's intentional. I mean, it's just horrible. And I'm going to show you how and why I've come to that conclusion. But basically, a big concern that I have had, and which I've recently stated in a different way, is that the biggest threat to nutrition research is medical ignorance. So, if a person or if a group or an organization or hospital or journal or whatever, if they take a group of doctors who don't know a damn thing about nutrition, and then they design a clinical trial, to them it looks reasonable, and to me as an expert who's been using an antiviral nutrition protocol now for 25 years, I look at those studies and in 3 seconds I can tell you what they did wrong. And it's obvious what they did wrong Because what they always, or not always, but one of the most commonly used strategies for screwing up nutrition research is to just underdose. So they should have used what was already established, which was 100,000 units for infants and 200,000 units for kids above 1 year of age, dosed twice, at least that. Why? Because that is the international standard practice in medicine for the past 50 years for the treatment of measles. They should have just taken the measles standard and applied it to COVID. I mean, that would have been the easiest, most brainless thing to do, but no, they had to screw it up. So I'll show you the articles that I've got in front of me as soon as my screen warms up again. There it goes, finally. So I'm going to look at this article real quick it's an overview. It's from the Cochrane Library, Cochrane. So the international standard now for the past, 50 years or more, maybe 100 years, I don't know, endorsed by the World Health Organization is 200,000 international units on each day for 2 days. So that's 2 doses of 200,000 international units for children. And then for infants, it would be half that dose, which is fine. 2 doses of vitamin A are not considered to be expensive and are not likely to produce adverse effects. So we know it works, we know we can afford it, and we know we should do it. And the World Health Organization, in a different article, in the review article that we're going to look at in just a moment, World Health Organization says that 250 million children under the age of 5 suffer from vitamin A deficiency. Patients with vitamin A deficiency have higher mortality and morbidity from respiratory infections. Vitamin A is obtained through the diet or supplements and is eventually converted to retinoic acid in the body. And retinoic acid is an active metabolite of vitamin A and the key regulator of immune function, and can alter the activity of both natural and adaptive immune cells. Well, why the hell didn't we hear about vitamin A then during the pandemic? If we're so concerned about kids who are supposedly killing their grandmothers with COVID, then why didn't we do a damn thing about 250 million children under the age of 5 with vitamin A deficiency? Now, World Health Organization has also published that 400,000 children every year die from zinc deficiency, and that was way before COVID. So if you look at the vitamin A status information, 250 million children are deficient, and a lot of adults too, of course, but I don't know why they just have data here for children. So you've got 250 million children under the age of 5 with vitamin A deficiency, and a hell of a lot more with marginal vitamin A status that should be supplemented with vitamin A. Now, so you've got this big group with vitamin A deficiency. That overlaps with 60% of the population that's deficient in vitamin D. That also overlaps with a huge chunk of the population that has selenium deficiency. I think that's 15% of the population. And I think maybe 40% of the population is zinc deficient. So, I mean, you're talking about huge chunks of the global population. Did anybody talk about vitamin A, vitamin D, zinc, or selenium during the pandemic? Yeah, I did. But did any of the government organizations talk about it? No, they didn't do anything. So it's just pathetic. Again, let me go to the page that has the clinical data on it. Because I did say, so remember, now the standard, I'm going to say it again, I think I already said it at least twice, but the international standard for at least the past 50 years has been giving kids vitamin A, 200,000 international units on 2 different days. Now, when COVID hit, what did they do for COVID? They gave them 20,000 international units. 20,000 international units, or 50,000 international units. So 20,000 international units for 6 days would be 120,000 international units for young kids. That's okay. But for the kids over 1 year of age, they should have received 400,000 units and they received 100,000 units. That's inexcusable. So they gave them 25% of what the international standard had been for 50 years. In a couple of other studies, mostly, Vietnam, Brazil, Tanzania, they did okay with their dosing. Here's a study, 2 studies out of China. They gave 1,500 international units or 2,000. I mean, that's like 1% of the appropriate dosage. I mean, that's just criminal. 5,000 international units for 7 days. That would be 35,000 international units. It should have been at least 100,000, if not 200,000. So here again, as I've said many, many times, because I've reviewed so much research on this, the pattern is systematic underdosing of nutritional therapy to undermine the results. So this is just some vitamin A that I bought recently at a local pharmacy. And each one of these is 100,000 international units. When I, as an adult, a responsible adult, when I want to take vitamin A, I take 500,000 international units for a day, for 2 days, for 3 days, for whatever. Obviously not forever, because vitamin A is, of course, eventually toxic. But when people are acutely ill or inflamed, or what's the other cause? I'll tell you that in a minute. When people are acutely ill or infected or inflamed, they're catabolizing vitamin A and they're losing vitamin A out through the urine. Same thing happens when kids are treated with steroids. Part of this report showed that when kids were treated with conventional therapy, they had reduced efficacy of vitamin A. You know why? Because part of conventional therapy includes giving steroids, and that depletes vitamin A. So they're giving a low dose and they're depleting it at the same time, and of course it's not going to work so well. So I'll put these articles on the web when I post this video and you can look at it, but I'm just giving you the quick overview here. When they want to make nutrition look ineffective, and that's the goal of medicine, they underdose, or they dose too late, or they dose too short. And that's what they did with these vitamin A studies in COVID-related illness, either acute or chronic, or COVID-related pneumonia. So it's just pathetic. But like I've summarized recently, the biggest threat to advancing nutritional science is medical ignorance. I mean, it's just pathetic and consistent, and I'm just, as you can tell, frustrated with it. The other component that contributes to the corruption and low quality of nutrition research is the fact that this multi-billion-dollar nutritional supplement industry doesn't fund the research, So they sell their vitamins and they sell their products and they make tons of money in general. I mean, it is a multi-billion-dollar market. And they don't fund. I mean, they don't give back to the science that they profit from. So, I can condemn the medical organization or the medical racket all day long, and I'm happy to do that. Medical doctors don't learn about nutrition. They learn to slander it. The journals publish crap. And medical doctors eat it up because it feeds their own ignorance, and it makes them comfortable in their own ignorance, for the vast majority who are ignorant. Obviously, some medical doctors have studied nutrition, so they're not all ignorant. But it's so consistent and predictable and repeated that it can't be done by accident. That level of incompetence just can't exist by accident. But again, I can slam the medical mafia all day long, but the nutrition industry is also guilty. I mean, they should be doing these studies, not waiting on governments to do them, or nonprofit organizations, or non-governmental organizations, because all of those groups have their own political bias, and they're usually kissing butt to the World Health Organization. So that's my quick summary. Again, today's the last day this office is going to look good, because like I said, I'm taking down the art today because we're relocating this week. But anyway, that's just my quick take on the vitamin A situation. Take care. You can see my other videos for more detail. Bye-bye. Helps prevent and alleviate various autoimmune diseases such as multiple sclerosis and rheumatoid arthritis. Again, an amazing 78% reduction in type 1 diabetes, and reduces the incidence and recurrence of various types of cancer. You will never see such a wide range of clinically important improvements with any vaccine or any drug. Now let's take a look at vitamin A. How could we justify giving vitamin A against coronavirus? Well, first of all, vitamin A isn't specific to any virus, despite the fact that the American Academy of Pediatrics seems to think that vitamin A is specific only for measles infection. So from the American Academy of Pediatrics in 1993, the World Health Organization and the United Nations International Children's Emergency Fund issued a joint statement recommending that vitamin A be administered to all children diagnosed with measles in community where vitamin A deficiency is a recognized problem and where mortality related to measles is greater than 1%. The recommended regimen is 100,000 international units by mouth at the time of diagnosis for infants younger than 12 months and 200,000 international units for older children. So we should be using high-dose vitamin A supplementation for virtually all types of acute infections, not simply measles, and I'll justify that a bit more here. Again, similar to vitamin D, we see a long history of use, very well studied, documented safety, affordable, widely available internationally, efficacy against a wide range of human viruses because we're not targeting the virus, we're improving host defense. Efficacy against a wide range of bacterial and viral respiratory infections. Vitamin D and vitamin A work together functionally to promote immunity and tolerance. So that's promoting immune defense, but also calming down what might otherwise be an excessive inflammatory or immune response. Vitamin D and vitamin A actually work together at the same nuclear transcription factor and receptor. Because vitamin A functions at a physiological level by improving overall defenses and improving overall health, we might say, you'll never see any drug or vaccine provide these same level of benefits. Let's take a look here at another document from the World Health Organization website. Vitamin A is essential